Blue Shield of California will soon manage the distribution of coronavirus vaccines in some parts of the state, including Los Angeles and Orange counties.
However, a number of other counties and cities are against this plan. Joining us now is healthcare attorney Harry Nelson. Harry, good morning. Good to see you.
Great to be with you guys. Good morning.
Good morning. So we all want to see vaccines get into as many arms as possible. Why is Blue Shield and the state coming under fire?
So, this contract with Blue Shield has become a little bit of a black eye for the governor. You know, this story started when the initial 6 million vaccines showed up in California. The state couldn't tell where 1.5 million of them had gone. They just sort of disappeared from the system, and it was a data problem. So Governor Newsom reached out to his friends at the CEO at Blue Shield and offered them a no-bid contract for $15 million. And now a lot of people are asking questions because it's not clear if that contract was necessary, if the counties needed the help. And Blue Shield has been a $23 million donor to the governor over the last 18 years or so. So that's sort of the source of the problem and the controversy.
And who are the other providers that are involved?
So besides, in addition to Blue Shield, we have McKinsey, the consulting firm, which has a contract for at least $13 million. I heard earlier that Accenture is actually one of the big players, another big consulting firm. And what they're putting together is this whole network for data. And so a lot of companies in the professional services arena.
And Harry, health officials in underserved communities, they're concerned about where the doses will go and how many they'll receive. What's the algorithm they're using to determine that?
Yeah, so Blue Shield has called a lot of attention to this data algorithm to help match availability. There's a lot of questions because nobody knows exactly what's going into the algorithm. Supposedly it includes stakeholder feedback and a whole series of features, but Blue Shield hasn't let anybody actually see how it works, and so a lot of experts are calling it into question and wondering if we should really be using this method to make sure that we have supply everywhere.
Can people who want vaccines still choose which one they get and then where they get it?
So you can choose which vaccine you get to the extent that you know which site you're going to, what they're delivering that day. It's not like not like McDonald's where you can just go and say I'll take the Pfizer or the Moderna. But we right now have 3 different sets of vaccine sites. We have the Blue Shield contracted sites. We have the county organized sites, a lot of hospitals, for example, and we also have federal FEMA sites around the state. So you can go to a lot of different places. It's your choice for every individual where you go. And if you do your homework, you might be able to get a sense of what doses, which vaccines they'll have at that particular time.
There's some reporting this morning in the newspaper that in San Diego, they're loosening the restrictions. Certain people could get it. If you're in LA, you still can't get it at certain tiers. Why is our state such a patchwork? And are other states just as sort of inconsistent in the way they distribute the vaccine as California is?
So California is definitely unique. Obviously, we're the biggest and most complex state. Part of what I've heard from folks at the county level is that, Los Angeles is going slower because we have many, many more health workers per capita. We have a much bigger system. So counties like Ventura or San Diego have an easier time, and they're getting through those top tier people, the nursing homes, healthcare workers, and they're getting to high risk individuals, and probably will get to a point where they open it up completely to everybody over the age of 16 much sooner than LA. It's just an unfortunate reality. We're a complicated large state, and LA is a complicated large city.
Yeah, it certainly is. Harry, thank you. Appreciate your advice this morning on all this. Harry Nelson, the author of 2 best-selling healthcare books and is a founder and managing partner of Nelson Hardiman, a healthcare firm. For more information, you can check out their website.
That's what he looked like when he had a goatee.
Yes, still ahead.